I didn't. Great, looks like you got it.
Okay, all right. Okay, folks, we're going to go ahead and get started for today. Today, it's going to be a heavy emphasis on the Animal Health Diagnostic Center at Cornell University. And our main speaker is going to be Dr. Manny Lejeune, who's the clinical parasitologist at the Animal Health Diagnostic Lab. And he'll be talking about some of the different testing that's available there for parasites, and then how you interpret those results, some of the special equipment he has. And then at 8 o'clock, Elisha Frye is going to try and join us, but she forgot that she had a dinner appointment. And so she's going to be trying to step out of a restaurant. So I don't know how that's going to work. That she'll talk to us a little bit about if you're having abortion issues at your farm, what kind of tissue samples and other samples you would try and get, whether they should be frozen or just chilled. If you're suspecting different types of diseases. And I have a bunch of noisy goats on my monitor, so I'm going to mute myself, and I'm going to let Manny go ahead and start. All right, thanks, folks. Okay. I do in between Manny's talk and Alicia's talk, or after Alicia's talk, we do have someone who has a pasteurizer for sale. And so I'll put up a little slide advertising that at some point. All right, thanks, folks.
Thank you, Dr. Stanton.
Manny, it's up to you now.
Yeah, can you hear me? Good. Okay, thank you. Thank you for the introduction. I'll get it going. I'm just viewing on my monitor on the other side, but my camera is on the another side, so forgive me if I'm not seeing you all. For this presentation, I just want to give a summary of the testings or different assays that we run in parasitology section at the Animal Health Diagnostic Center, Cornell. Having some issues to move my slide. Okay. So we have a website. If you Google Animal Health Diagnostic Center, it leads you to that web page. And then on the top, you have a scroll down for different laboratories. So if you click that, and you can select parasitology, and leads you to the parasitology section, and you would find most of the information that I'm going to talk today available on that web page. And we also have cool educational information about different parasites and parasite testing that is available, although I can be unable to capture all those on this slide, but this is the page where I would redirect anybody who is interested to learn about what's happening in the parasitology section at the Animal Health Diagnostic Center.
Manny, if you can be at all louder, that would be helpful.
Yeah, can you hear me now? Is that okay?
Yes.
Okay. All right. So at the parasitology section, we offer different assays, but I kind of listed the ones that are related to small animal ruminant parasitology. And the top one here is fecal flotation test. And on this side, I have the volume for the financial year from 2021 to 23 for the last 3 years. And you might notice the fecal flotation test is the high volume test that is offered from our section. And I have a list of other tests, but I'll be focusing in this talk for the first 4 tests. But we do have, for example, Behrman fecal technique, which we use to do for lungworm detection, Toxoplasma gondii Elisha, which we just retired today. And as a replacement, we are offering Toxoplasma modified agglutination test. If we are interested at the end of my presentation, we can talk about that. And we do get a lot of parasites submitted, not just from small ruminant, from other animals as well. And that's one high volume test from our lab. And Elisha for some of the common protozoan diseases like giardiasis and cryptosporidiosis. We do have Elishas for that. and skin scrapings, which is another common test that is offered from our section. But for this talk, like I will focus on the first 4, starting from the fecal flotation test. So why we do fecal examination? I just got here a slide to explain the importance of doing fecal examination. Most of the helminth parasite or even protozoan parasite, the predilection site is the digestive system. We do see parasites in the respiratory system, and in all other organ systems, you do see parasites. But one cool thing about these parasites, they try to avoid their parasitic stages that are responsible for transmission to another host through the fecal samples. Obviously, any parasites present in the digestive tract, so they avoid their eggs or oocyst or cyst in the fecal sample. And similarly, the lungworms, which are there in the respiratory system, they avoid larvae, which are avoided in fecal sample. And I have here integument, where like you would find mites and other things. So animals, when they lick the skin, and these are taken inside, and you may see them avoided in the fecal examination. So this is a common situation in a small ruminant, where you would expect parasite stages of different parasites present in different organ system, all coming in fecal. And that's why a fecal examination is a comprehensive exam to detect parasites that are present in different organ system. I do have here a circulatory system, but it's not relevant to small ruminant. But like in birds, or even in dogs and cats, there are some trematodes which are present in the blood vessels, which void their eggs, and the eggs are coming in the fecal sample. And here, the nervous system, and I guess like most of the people are aware of Paralophus strongylis tenuis, shortly called P. tenuis, which is a brain worm, and it lives in the meninges, just coating the brain. And they void larval stages, which goes through the blood vessel, reach the gut, and then are voided in the feces. And it's the counterpart of P. tenuis is P. andersoni, which are seen in the skeletal muscle of a white-tailed deer. So these are mostly in the white-tailed deer, and then they are also voided in the fecal sample. So the idea here is, or the take-home message is, fecal examination can be done, and you can able to find parasites that are present or having predilection to different organ system, and you can detect that and do a diagnosis. So these are some of the photos that I took from the fecal examination. I know you guys know how difficult it is to work with fecal sample, but at the end of the day, when you get to see all these cool parasites that are present in fecal sample, that makes my day. And let me start explaining what I have here. So Giardia, which is a protozoan parasite, and the Cryptosporidium, also a protozoan parasite. So they shed, like Giardia shed the cyst. So you can see here, these are cool cysts of Giardia, and Cryptosporidium, it shed the oocyst. So these are an example of how protozoan parasites are voided in fecal sample. And I do have here Coccidia, or otherwise called as Eimeria, the stages of which would look similar to what I present here. And Strongyles, it represents a group of roundworms, which are mostly present in the gastrointestinal tract, abomasum, as well as in the small intestine. And they shed parasitic stage, which are the eggs. The eggs looks the same for most of these roundworms, and we call this as a group of Strongyle. Eggs looks the same. And here, Munitia, which is a tapeworm that are voided again in the feces. And Dicrocilium is a fluke that lives in the liver, and the eggs again seen in the feces. Scrabinema is a pinworm, and Mularius is a lungworm, and Dictyocolus is a lungworm, and Trichuris is a whipworm. So this slide, like I'm just exposing you to different parasite stages that we observe under microscope after processing fecal sample. And that's how like we detect different parasites. So what we actually are doing, or how we do this detection of different parasites in fecal sample. For that, like I just need to give you a brief about what these different parasite stages are. And then each of these parasitic stages have their own buoyant density, and they can float in a solution which is of specific gravity that is higher than the buoyant density. For example, specific gravity 1 means it is the specific gravity of water. And most of the parasite stage have buoyant density greater than specific gravity of water, so they won't float in water. But if you select a solution such as zinc sulfate, which has a specific gravity of 1.18, then many of these parasite stages that has buoyant density, which is lesser than 1.18, they would float in this solution. Similarly, sugar with 1.33, higher specific gravity, and in this solution, most of the parasite stages can float. Then you wonder like why we use, why I'm mentioning two different solutions here. So zinc sulfate, which has a less specific gravity, they can float delicate things like Giardia cyst, which has a cyst wall, which is very delicate. If I float Giardia in sugar, that would kind of distort the wall, and you won't appreciate Giardia cyst in fecal sample. That's the reason why like we use zinc sulfate to float Giardia. Similarly, the larval stages like lungworm larvae, they float well and without any distortion in zinc sulfate, but sugar kind of distorts the larvae. So what we do in our lab, like we float in each sample get floated in these two different solutions, zinc sulfate and sugar, and we capture that under the cover slip, which I'll mention in the next slide how we do. And we look under the microscope and try to detect what are the different parasites that are present in the fecal sample, and that's how we do our detection. So fecal flotation test, and if you look at our web page, the test code for fecal flotation is float. And this is just the procedure or the protocol. I'll quickly walk through. So what we need is 10, or minimum 10 gram of fecal sample. That's what we are weighing in here in this wax cup. So we mix this 10 gram of fecal sample in 150 ml of tap water. And after mixing properly, we sieve through a tea strainer. And then the filtrate is then poured into 2 centrifuge tube, and each of this centrifuge tube, like what you see here, has a volume of 15 ml, meaning of this 150 ml of the solution, we take 15 ml of liquid, 215 ml of liquid, and fill this centrifuge tube. And then we do a first centrifugation, which would allow all the particle to sediment at the bottom, and the supernatant water is discarded. And after discarding, then we use these 2 different flotation solution, like sugar and zinc sulfate. So we pour them in each of those tubes, and with an applicator stick, like we mix the sediment at the bottom, and then after mixing thoroughly, we then refill the centrifuge tube to the brim with the corresponding flotation solution. And once it forms a meniscus at the top, then we place a cover slip, a glass cover slip on it, and then we put the whole thing in a centrifuge, and again centrifuge for another 10 minutes. And after centrifugation is done, we pick the cover slip and then put it on the slide. So during the centrifugation process, as I mentioned, the parasite stage, which has buoyant density, which is lesser than the specific gravity of the solution that we are using, they all get floated up and then collected underneath the cover slip. So we pick the cover slip and put them on the slide. Again, remember, like I mentioned about floating in zinc sulfate as well as in sugar. So we put them side by side and take it to the microscope, and the staff who are highly trained would read those slides and try to identify whatever parasites that are present and do the diagnosis. So the reason why I put all these images in here, because to explain how difficult it is or how time consuming it is, that at least it takes 90 minutes for us to complete this test. And again, we are doing 2 different flotation tests. And that's the reason why the float test that is offered through our lab is a little pricey. It's $25. So, and you might now understand the reason why it is pricey. So
Dr. Lejeune,
yep.
One thing I wanted to point out is that your you're requiring at least 10 grams of feces for this sample. And so for people who are used to doing their own fecals and only using 2 or 3 or 4 grams, they need to realize that because you're doing a couple of different, using 2 different solutions and everything, you need a larger sample than what they're used to taking. So this would be 10 gram. So
no,
it would display.
Let me clarify. Sorry for the misinformation so we take 10 gram and mix in 150 ml of water, and then from this we take 15 ml. So in this 15 ml, you would get 1 gram of the sample. So 10 gram we use to mix, but when we are aliquoting, we are taking 15 ml, meaning like it is just 1 gram present in that tube, which is floated. At the end, whatever parasite stage we are counting or like looking under this slide, so that would amount to parasites present in or like eggs present in 1 gram of feces. Does that clarify?
But basically, you want the people to send you at least a 10 gram sample.
Yes,
right?
So we want people to send us at least 10 gram because parasite stage are not like completely dispersed or properly dispersed all in the fecal pellet or in the fecal sample. So taking a 10 gram and then homogenizing in water would help us disperse those parasite stage which are like concentrated in one pellet. So for that reason, we need at least 10 gram to get a meaningful result.
And folks, if you don't have a way to weigh 10 grams, one thing to keep in mind is that we usually assume that a gram of feces displaces about 1 milliliter of water. So if you have a 12 cc syringe, that you use to give shots and stuff, if you were to fill that 12 cc syringe with manure, that would easily be your 10 gram sample. We did have one question, Dr. Lejeune, and I don't know if you want to address it now, but it was someone asking if you can find P. tenuis from a sheep or goat in a fecal sample.
As I said before, this is a parasite for which white-tailed deer are the definitive host. So if you are examining a fecal sample of white-tailed deer, you may see those larvae present in there, but sheep and goat are aberrant hosts where this parasite just migrates to the brain and you won't see them shedding larvae in the feces. So P. tenuis, like you mostly see in the fecal sample of white-tailed deer.
Great, thank you.
Okay, so moving on. So our staff then use the key that we have for each host, and then they compare this key and then make the diagnosis. I'm not going to walk through what's there in the key, but it's just an example of how we proceed with our parasite detection. And once we identify the parasites, then it goes in the result, which is then finalized and sent to our clients. And this is one example of a goat fecal examination where a client requested a float test, and we see here, so we did the sugar and zinc sulfate fluoridation, and we found different Eimeria or coccidia, and the total count of all the Eimeria is mentioned here. So for 28 oocysts per gram and strongels, this number of 4,800. I just want to highlight that our lab, we kind of identify coccidia to species when other labs, like they only call that as coccidia and give you a number, but we do identify them to species, and there is a reason which I'll explain in the next slide. Here is the list of different coccidia in cattle, sheep, and goat. And as you see, there are more than 10 species in each host, but not all are considered as pathogenic. So in cattle, Eimeria bovis and zurni are considered highly pathogenic, and in goat, it's Eimeria ninacoliaci or Eimeria caprina are considered highly pathogenic. So the reason why we identify them to species, because if you look at the drugs that are approved, the drugs are labeled against highly pathogenic Eimeria. For example, in cattle, bovis, and zurni are listed in the drug label, but not all other Eimeria. So in order for you to have that confidence to go ahead and treat, like according to the label, then you need to know if pathogenic Eimeria is present there or not. So based on this information, if I go back, like, in this, like you see the goat sample had Eimeria caprina, which is a pathogenic Eimeria. So if we see pathogenic Eimeria in the list, then I strongly advise our vet to go ahead and do the treatment because you're seeing pathogenic Eimeria. But what if there is no pathogenic Eimeria listed, but you still have a number, say, for example, 500 oocysts per gram, then how would you interpret that result? So we don't have as solid evidence on what is the cutoff for treatment. But what I did in my lab, like I went in the last 5 years, pulled up all our test results, and then went on to figure out like how many oocysts that we are detecting normally in different hosts. For example, in cattle, majority, I would say 62% of our sample, we do not see any Eimeria at all. Compared to sheep, which is like 21%, we don't see Eimeria, and goats, it's only 11%, no Eimeria. And among those that tested positive for Eimeria, 32% of cows had Eimeria, which are less than 1,000 oocysts per gram. But in sheep and goat, like almost like 65% of those samples had less than 1,000 oocysts per gram. On the other hand, like if you see oocysts above 10,000 to 100,000, they are like a small fraction of the samples that we have tested, but these are related to mortality events. So we generally see very high amount of our number of oocysts associated with death in animal. So in this case, like if you ask what we should do, if we see oocysts count, like I would suggest like you should look at the clinical signs associated with the number. So if there is diarrhea associated with the number of oocysts, then I would, and in the absence of other pathogen underlying condition, then you should go ahead and treat. Otherwise, like if you are seeing less than 1,000 oocysts per gram, probably it's a tolerable level and no treatment is required. For strongyles, again, in the result that I showed before, so we counted like 4,880 X per gram. So what this means, but before I explain, I also wanted to let you know, strongyle is a name given to a list of different roundworms that are present in the gastrointestinal tract of ruminants. And these are some of the members of Trichostrongyloideae, which is a superfamily, and they shed parasite stage, which is the egg, and the eggs looks the same. It's really not possible for us, or it's hard for us to differentiate different species of strongyle based on the appearance of the egg. Morphologically, it is indistinguishable. But on this side, like I have the guide to interpretation, which is again, it's based on information published in a book, but I've seen other references which kind of mentions differently, but I just stick with this reference from a veterinary parasitology book, where in cattle, like if you have mixed infection, anything around 100 X per gram is considered light, and 200 to 700 as moderate, and above 700 is considered as heavy. On sheep, like if there is mixed infection, when I say mixed infection, most of the time, if you open up the gut of a sheep or goat or cattle, like you always see a group of different species of nematode present. So single infection with any one of these species listed here is rare. So mixed infection is the rule. And again, in sheep, like if there's mixed infection, then less than 250 is considered light, around 1,000 is moderate, and about 2,000 is heavy. But I also highlight here Haemoncus. Haemoncus is the most pathogenic worm present. And if Haemoncus contortus alone is present, say, for example, in a sheep or in goat, then these are prolific egg shedders. So even if you see around 8,000 eggs per gram present in a sheep, this should be considered as moderate, and above 8,000 is considered as heavy. But one challenge with us is like, because all these parasites, Haemonchus, Osteinergia, Trichostrongylis, they shed egg, and the eggs are morphologically indistinguishable. So how would you identify Haemonchus if it is present in the sample or not? For that, our lab offers a test called Haemonchus egg test. The test code is HEGG, H-E-G-G. And again, you see in each report where we see more than 100 eggs per gram of feces, then it goes with the comments advising the client to consider doing a Haemonchus egg test to see if Haemonchus canthatus is present in the sample or not. And here is the worm, Haemonchus canthatus, which is a barber pole worm. And many of them know why it is called a barber pole worm, but again, I'll explain why it is. And these are prolific bloodsucker. And you see here the red part, which is the intestines. After it imbibes the blood or sucks the blood, the intestine appears red in color, and it kind of winds through the ovary, which is white in color, and that gives the characteristic barber pole appearance. And that's why the common name for this worm is barber pole. Because it is sucking a huge amount of blood, and it uses all the protein that is taken from the blood meal to make eggs. So that's why they are prolific egg shedders. They shed a huge amount of eggs in the feces. And again, if it is a mixed infection, it's really hard for us to differentiate the Haemonchus eggs from the other strongyl eggs. And in HEG test, what we do is like we make these eggs, and we do a staining with what is called as peanut agglutinin, and this component would attach to the eggshell, specifically the eggshell of Haemonchus, but not to all other strongyl. So when after you do this staining and you pass normal light under the fluorescent microscope, you would see there is one egg here, another egg here, they are not fluorescing. But if you change the filter to FITC and allow a particular wavelength to pass through, and that you can see the Haemonchus egg this gets stained, and you can see that, but the other eggs, strongyl eggs, it's not visible. So in that way, like we know, we can able to identify Haemonchus and confirm its present in a fecal sample. On the other hand, like we can also do a nematode larval culture if you want to identify what are the different strongyls that are present in a fecal sample. This is a time-consuming procedure. It takes at least 14 days. Again, we need at least 30 gram of fecal sample. So we mix this 30 gram of feces with vermiculite in a cup and moisturize that with water, and then substance that should prevent fungal growth. And we aerate them and leave it at room temperature for 14 days. And on 14th day, we fill this cup with water to the brim and put the petri dish on, flip it upside down, and put warm tape water in the petri dish. And what happens is like the larvae from the fecal sample, the cultured larvae, the third stage larvae, would then migrate itself into the water that is here in the petri dish. And we collect this water, centrifuge, and sediment those larvae, look at a microscope, and based on the morphology, we could able to find whether it is Haemonchus or strongyloides or any other thing. And that's how like we do this diagnosis. And there is interest now to do this nematode larval culture to find out if the pathogenic Haemonchus is present in the fecal sample or not. But as I said, it's a 14-day procedure, and it's really hard for anyone to wait for 14 days to get the results. So for that, like we have a grant proposal which was funded. I mean, we are doing a type of PCR to get a specific target amplified from this roundworms, and then we were able to identify what are the pathogenic species and in what proportion it is present. So let me just quickly walk through how this is done. As I said, like mixed species infection, strongyl infection is common in a herd. So I just took a cattle herd as an example. So each one of this cow has its own nematode population. So for example, 5 strongyl species in this cow. And what we are doing is like we just collect all these larvae, either the third stage larvae after culture, or now we are trying to do or collect the egg directly without the culture. So we collect those eggs and extract DNA And there is one marker called ITS2, which is present in the DNA of the parasite. So we try to amplify this region. And then what we do is like after doing PCR for each of this worm, the PCR products are then barcoded just to indicate which animal the samples are coming from. And after they are barcoded, the PCR products are then clubbed together. And then we have a cool sequencer, which can be attached to your workstation or to the laptop. And you put all these amplicons into the sequencer, and the sequencer would do the sequencing, and it reads the barcode, and based on the barcode, it then segregates all the marker or the amplicons according to the barcode. And then based on the information that is present in the marker, we would know what species of nematode that is present and in what proportion. Like for example, here, this is you could see high proportion of osteitegii, and in some herd, like you can also see Muncus placiae present. So it gives us an idea of what worms are present there or what is absent. And we are again trying to do the same sort of experiment to find the markers that confer resistance to the anthelmintic drug. So in future, from our lab, we are thinking about offering this test of finding the nemabiome, identifying whether pathogenic nematodes are present there or not, and also trying to find out those markers that confer resistance to different drugs. So it would, in near future, maybe in next 2 years, we are thinking about completing the validation of the study and offer that test to our client, which would be much more cheaper than the fecal head count reduction test that we are currently promoting. So the last part of my talk is to mention about a test that we do for monitoring anthelmintic resistance. So before, I just want to give you a current scenario of what anthelmintic resistant issue is prevalent in the US. So this data was taken from 2012, but the situation is becoming much more worse now, I would say. And for many of the drug classes, many small ruminant farms here in North America are experiencing resistance, so 100% resistance to many of these drug classes. And for different parasites in sheep and goat, like they also are showing resistance to many of the common drugs that we use. And how this resistance building up, I just want to quickly touch on that topic so that gives you an idea of why we need to do fecal head count reduction test. So here, in one example of a farm where you have, again, resistant and susceptible worms present. So the red one is the resistant worm. And in this example, we see resistant worm present 8% of the larvae that is present in the pasture, compared to the susceptible 92. And if we adopt the strategy of treating all animals in the flock, and if you do so, then you would kill all the susceptible worm, and the resistant worm is still present in some animals, and they produce the progeny, and this progeny would then contaminate the pasture. And the pasture level, like if you look at, so in few generations, you would see 27% or like there is an increase of this resistant worms that are there in the pasture. And that is how this resistance is building because of like global warming, which is like treating all animals in the herd. But if you want to get rid of, then you need to think about creating refugia, which is like not treating all animals, but treating just the animals that requires treatment and leaving the normal looking animals without any drug treatment at all. So if you follow that strategy, then you would see like only selected group are treated, and refugia is maintained in some animals, and that would allow the susceptible worms to take upper hand in the pasture, and the resistant worms are diluted. And over the period of time, you would see the resistant worm is still there, but the resistant worm numbers are kept to a minimum. So by doing this type of refugia management, like you may still able to prolong the life of the drugs, which are already, the worms are picking up resistance already to those known classes of drugs. So in order to monitor resistance, like the only test that is available right now is fecal egg count reduction test. And Dr. Stanton mentioned about drench-right, which is not available now, unfortunately. But a researcher at Louisiana State University is trying to revive that test, but I really don't know what is the current status of that test in there. But fecal egg count reduction test is a simple test that can be done to monitor the emergence of resistance in a flock. So this is done basically by collecting fecal sample before treatment and 14 days after treatment, and comparing the egg count and doing a percent reduction using this formula. So if 100% reduction is seen, then we know the drug is highly efficacious, and if there is 0%, then obviously it's low efficacy. So in our lab, like we offer this fecal egg count reduction test for day 0. People just submit as a float test, and we charge $25. And if you submit a corresponding sample on day 14, it's just charged $5. So altogether, for doing a fecal egg count reduction test, you are paying $30, and you get to know what is the percent reduction for the drug that you are administering. And the current status. So, or like, how would you evaluate the fecal egg count reduction test? So after doing that percent reduction, if there is greater than 95% reduction, we know whatever drug we are using is effective. Between 90 to 95, considered as a suspected resistant, and 80 to 90 is likely resistant, and less than 80%, we know the drug is ineffective. A highly resistant population is present in there. And for doing fecal egg count reduction test, currently our lab is offering as an individual animal basis. But in near future, we are thinking about offering this as a composite fecal. Like instead of doing, like the recommendation is at least do 15 animals in a flock. But if you're doing 15 animals, it would cost, I know like it is expensive, but if you're trying to do as a composite fecal of pooling samples from 15 animal on day 0 and 15 animal, same animal on day 14 and doing this comparison. There are studies done to prove that it is a valid test. And in that case, like the cost can be considerably reduced. So that's where we are getting at. Hopefully in the near future, our lab would offer test for composite fecals. And the last slide is how to mitigate resistance in small ruminant just based on the fecal egg count reduction test. So we must acknowledge that drug resistance is present in many forms in the US, especially in the small ruminant, and the fecal egg count reduction test is a prerequisite before you even think about anthelmintic treatment. And current recommendations are like instead of using a single drug treatment, you should use at least 2-3 drugs. Even if resistance is known, it's better to combine 2-3 drugs and then do a combination treatment is preferred compared to single drug treatment. But this combination treatment should be coupled with maintenance of refugia, which is, again, if it is small ruminant, then you can think about a pharmacia-based selective treatment, meaning like that would help non-treatment of anything that is not scoring about 3 in the pharmacia chart. Or in the other hand, like you can treat all animals except 10 to 20% of the well-doing animals, so that kind of maintains this refugia. So if you're not maintaining this refugia and treating the whole herd with 2 to 3 drug combination, then you are setting those herd or flock to emerge with a multiple drug-resistant worm, which we don't want to see. So that's why like a combination treatment with the maintenance of refugia is an important recommendation to follow. And anthelmintic treatment can be coupled with copper wire particle bolus, which is again a very favorable management strategy. And also remember, we have to stick with the correct dose level. And many of the drugs that are labeled has dose level specific for sheep and cattle. But for goat, like, yes, everybody knows, like they metabolize those drugs faster. So they have to be given a different dose. Like many people follow 1.5 to 2 times of the drug that is generally used for sheep. And I guess like the consortium has information about what amount of drugs need to be treated for goats. And oral formulations are preferred. And again, other recommendations are do not treat all animals when you are trying to move animal to a clean pasture. Again, follow targeted selective treatment. And again, when treating a pregnant animal, do not treat all pregnant animal before parturition. Do targeted selective treatment of those that needs treatment, but not all of those pregnant animals. So that's all I have. And this is my team at the parasitology lab, which kind of helped me on a daily basis to keep our lab moving. And Dr. Bowman's lab and his research folks like which I interact with, and they are very helpful for my success. And the funding agency from where I got funded for doing some of the advanced research that would help us come up with cool testing in near future. Thank you for listening. And if you have any questions, please feel free to ask. And I think I have some questions in the chat.
Manny?
Yeah.
Before, would you be okay with us waiting to answer your questions and letting Elisha Frye talk for a little while, because she has
sure. Yeah. Go ahead.
She has to get off at 8:30. She's run out of a restaurant.
No problem at all.
Talk. So we'll let her talk a little bit about abortion storms and what kind of tissue sampling and stuff is needed to try and see what the cause of your animals having abortions is. And then at the end of that, we'll go ahead and do your questions, if that's okay with you.
Yeah, it's okay. Can I stop sharing my slide?
Yes. Go ahead and stop sharing. And you can look at the chat and start checking out your answers. And then, so Elisha's online now and she has her stuff here. So Elisha is go ahead and introduce yourself. You're also at the Animal Health Diagnostic Center at Cornell. And thank you so much for being willing to step out of the restaurant to do this.
Okay, thank you, Tatiana. Hi, I'm Elisha Frye. I'm sorry that I'm in my car, but can everyone hear me and see my presentation okay? Yeah?
Yep.
Okay, great. So I was just going to talk very briefly. If you're dealing with an abortion, the best thing to do is to wear gloves and rubber boots. You want to protect yourself. A lot of the things that can cause abortions in small ruminants can also make humans sick, typically only if they're immunocompromised or the very young or very old, but don't do this, basically. Don't do a dystocia barehanded. That is a no-no. You should be wearing protective equipment and then washing your hands afterwards. So that's just kind of a general rule. And you always want to collect fetuses and placentas and refrigerate them if it's a hot day, even if you don't know what you're going to do. I would just try to save placenta. That's a special sample that I feel like sometimes it's gone, right? Like an animal will eat it and you just don't have it. But if you have placenta, save it and save the fetus. You would like to take the aborting doe or ewe and isolate her from the rest of the flock or herd. And then you can take the doe's temperature. And those are things that you could do before you call the veterinarian.
And do you want us to freeze those placenta and freeze that fetus, or is it better to just keep them refrigerated and send them as quick as we can?
If you don't know when you're going to send them, I would freeze them. So I always, if we get samples to the lab within 24 hours, refrigeration's fine. If it's like a Friday night and you don't want to call your vet and it's going to be Saturday, when you call your vet, you should just freeze them because you don't know when you're going to get it to the lab. So when in doubt, you can freeze, but refrigeration is good if you know you're going to be able to drive them yourself or ship them the next day through your vet. And then some questions your vet might want to ask you is, am I muted or am I okay? Okay. Are there, what vaccines do you give to your flock or herd? And at what stage did you note that the animal was aborting? And then keeping track of the number or percent of animals that have aborted and the health status of the flock and the dam specifically, and any diet related changes. Just briefly, when you're talking about an abortion, the gestation length for small ruminants is 150 days. So you can have stillborn and premature animals, which are right up to, full term. And there's an interesting quote from a book that sheep and goats have a high incidence of abortion compared with other farm animals. So 5% is considered a common 5% of abortion. So less than 5% is good, less than 2% is excellent, and above 20% is abortion storm. And this is, some people would not tolerate, right, a 20% abortion rate. And it doesn't mean you don't have to do diagnostics. It's just interesting to think about that for whatever reason, these species are a little bit more prone to fetal loss than maybe the other domestic species. I don't know if you want me to keep going, Tatiana, or just field questions about specifics from the group. What would you prefer?
It can go either way. I know one person had a question about what's the difference between an abortion and a stillbirth. So I guess if you're having a lot of stillbirths in the herd, you could consider that an abortion storm, right? As far as some causes of abortion are going to cause abortion to occur very late, versus some causes of abortion will cause them to occur early. So if you're seeing, so you might be seeing a lot of what appear to be, full term or close to full term stillborns, possibly, correct?
Right. Yes, and you could, I think stillborns would, a high percent of stillborns or more than you're typically used to, it would raise an alarm, and you could do diagnostics on that as well.
And then I did have one question, and I don't know if it's coming up later, but you mentioned keeping fetuses and keeping placentas. If you're suspicious that it's Cache Valley fever, would you just send in the placenta, or would you try and get the fluid around the heart separately?
Yeah, you know what? I'm going to just skip. I feel like Cache Valley is the more interesting disease, so I'm going to skip to Cache Valley, just so I make sure I cover that for folks. So Cache Valley is a weird one. It's spread by mosquitoes. So a naive pregnant animal gets bit in the fall, and then the virus completely leaves the doe and the fetus, and then they don't abort until January, February, or March. So by the time the animal aborts from Cache Valley, virus is long gone. You cannot find the virus. The only way that we can really confirm a Cache Valley abortion is by getting fluid from the fetus and doing an antibody titer for Cache Valley to show that it was infected early in gestation. So ideally, we want you to get a red top tube from the doe, and also your vet will collect the fetal fluid. If you bring the fetuses directly to the lab, the pathologist who does the autopsy will collect the fetal fluid. So that's a weird sample that people don't usually think of, but the placenta actually will not help you at all for Cache Valley particularly. So it's hard to remember all these little, like which disease requires which sample. That's a lot to remember. I think it's easier just to like get the fetus and the placenta and bleed the doe and have all of that saved properly. Even the vets have a hard time remembering which tissue matches with which disease. So that's kind of what my job is. And so I think it's better if folks just get everything. Sometimes the fetuses are small or the fluid's yucky and we can't actually run the test. So the other telltale sign with Cache Valley is these deformities that you can see in the fetus. So, if they're infected in this very brief window, 32 to 48 days of pregnancy, you can get deformities in the brain, the spinal cord, and the muscle. And I'll show you some pictures. So this is a Cache Valley Cache Valley fever fetus. You can appreciate, sorry, I've got to move my little icon here. So you can see this, the limbs are all kind of contracted in and deformed. This limb looks really abnormal, the right front limb of this lamb, and then these hind limbs are also really deformed. These are some photos from Dr. Mary Smith of a goat kid and then they took x-rays of the deformed fetus, which is really cool. And you can recognize that the vertebral column is very abnormal, right? It's very deformed. And then the hind limbs are also really deformed. So these are classic Cache Valley fetuses. This another picture of a Cache Valley fetus with the wry neck all twisted up and the limbs very deformed. They can also have defects on the brain. So on the left-hand side, this is a normal brain from a small ruminant. And then this is a fetal brain from a Cache Valley fever fetus. And it's basically like a collapsed pouch that probably had some CSF fluid in it. So the brain basically never even developed. You need these nice indentations or gyri to have thought processes. And so this brain is just really deformed. So that's the deal on Cache Valley. The good news about Cache Valley is that once you've been exposed, you're immune for years to life. And some folks consider breeding outside the mosquito season, which is hard to do with climate change, right? Because our mosquito season is longer when it's warmer more of the year. And this is just a little chart of the Cache Valley titers here at the lab. So of the samples that we've tested, 22, sorry, that's the toxic, 30% have been positive. So it's out there. It's a real thing that's definitely becoming endemic, I think, in our region. So I'll kind of stop there and let you ask some questions. I think unless there's another pathogen that you folks had in mind.
So for things like chlamydia, what would make you suspicious of a chlamydia infection?
Let me jump to my chlamydia. So chlamydia causes this placenta that looks really infected, right? So you have these big kind of plaques of almost like pus on them. So that is one telltale sign that you have chlamydia. So we don't actually find chlamydia all that commonly here at the lab from abortion workups, but we have a couple different tests where we can definitely rule it out. I think it's kind of a frustrating one because sometimes animals can shed it in their feces, and they, if a doe aborts from it, another doe can go sniff the vulva, and then they're going to get infected themselves. But if you have placentitis or infected looking placentas, that might be the first clue that you're dealing with a chlamydia abortion.
And what sort of abortion storms do you see most common in the lab nowadays?
I would say Cache Valley is definitely the number one. And interestingly, in 2021 and 2022, we had a lot of them. And then for whatever reason, this spring, the January to March window, I don't think we've had any. So I'm kind of wondering if there's a lot of herd immunity where animals have been bitten by mosquitoes and they've got a lot of antibodies, and so they're immune, and so they can get bit by another mosquito that has Cache Valley in the fall while they're pregnant, and they can just clear the virus and not have the congenital defects. That's my one theory. But I just want to mention that if you have sheep or goats in New York State, we do have a discount through the lab if you send the whole fetus in. So I strongly recommend that, where we do a bunch of testing and the whole autopsy at a set price. So you don't have to pay piecemeal for each test that's done. So if you're able to drive the animals to the fetuses to the lab, you can even drive dead adults to the lab. We don't take alive animals. They have to go through the hospital, but dead animals are welcome to come on the necropsy floor, and we do have discounts for them that can help you get to a diagnosis and not break the bank, hopefully.
Does anyone else have any questions for Dr. Frye about abortion storms or about what other kinds of tests they do at the Animal Health Diagnostic Lab? You can either put them in the chat or just ask directly.
Are there any vaccines for any of these?
There are, yeah. So there are vaccines for chlamydia. I'm giving you a very abbreviated, choppy version of a longer presentation that I'm happy to give at some point. But there is a chlamydia abortus bacterin vaccine. This is a picture of it here. I don't have any personal experience using it, but that is out there. I will just going to go back to my kind of list of pathogens that cause abortion, and I don't think that there's any other vaccines off the top of my head. So here's my pathogen list, I call it. So chlamydia, Coxiella, there's definitely no vaccine for Coxiella. In Australia, there's a vaccine for humans. I don't know if that's used in the small ruminants, but in the US, there's nothing. Campylobacter, I'm actually not sure. I do believe that there is a Vibrio vaccine out there, but I'm not totally sure. Listeria is a bacteria that's, found in soil and likes cold temperatures. There's no vaccine for that one. And then the viruses, Cache Valley, which I just mentioned, there's no vaccine. And then pestiviruses, border disease, and BVD. BVD is bovine viral diarrhea. That is more of a cow cow disease, and there are cow vaccines, but I don't think anyone's using that and small ruminants because it's very rare. And then toxoplasma, you've probably heard of. That's actually a parasite that's transmitted by cat feces, and there's no vaccine for that either. So we are somewhat limited, I think, in the small ruminant world for preventing abortion with vaccine.
Okay.
Is it possible if a ewe has triplets and one of them comes out dead, that it had Cache Valley, or would Cache Valley be more likely to cause problems in all three of the lambs?
That's a good question. Cache Valley can affect like one animal out of twins or triplets. So you could have a singly affected animal. So I wouldn't rule it out just because you have two healthy and one affected. Okay,
thanks.
Someone asked in the chat, could you tell us more about abortion from listeria? Yeah, that's at the very end of my presentation. I'll just get there real quick. Sorry. So like I said, it's found in the soil and feces and silage that's not dropped to the low enough pH that it should be. And it likes refrigeration temperatures. So I think about like cold cuts, right? Like you can get listeria from eating spoiled cold cuts because they're kept at refrigeration temperatures. And there's different presentations. So you can have circling disease, and this is a picture of an affected goat with like the droopy ear. And so that means that it's affecting their brain and the central nervous system. But a different form is abortion. So they're kind of separate. And Dr. Mary Smith has told me that you usually don't see both at the same time. If you're seeing neurologic disease, you won't see abortion, and vice versa. And we can grow this on culture from the placenta and the fetus. So this is something we can actually easily diagnose at the lab. We can grow it here.
Any other questions for Elisha? And we're hoping to have Elisha speak at the Cornell Sheep and Goat Symposium this coming summer, and about abortion diseases and stuff. And I will be more, I'll have more time. I'm putting my email in the chat if folks want to reach out to me with general questions. I can't give any treatment advice because I'm not your actual attending vet, but I'm going to put my email in the chat in case folks want to reach out to me that way. And Elisha, can people also reach out to you if they're trying to find out what kind of testing for CAE or for caseous lymphonitis and stuff Cornell has available? Usually those kind of questions you should ask your vet and encourage your vet to call me, because there's some things that the lack of the VCPR, the veterinary client patient relationship, because I'm not the actual vet who's going to come and see your animals or make any decisions about your animals, kind of limits what I can do. But sometimes I have meetings with the vet and the farmer via Zoom, and I'm happy to do that. But you can always be like, hey, you should call this person. And a lot of the vets already know me, the New York State large animal vets. But I would encourage, that's usually the route that folks should go through, is to go through their vet. If you can't find a vet, I could probably help you find one too. But and then also, like, Manny gave us the website for the Animal Health Diagnostic Lab. So people can also go there and look at what tests are available there. And then they can talk to their vet about whether for some reason it might make sense to do some of that testing if they're bringing new animals into their herd, or if they suspect they may have a problem. Yes, exactly. The website is open to anyone who wants to look, but then more, detailed or kind of catered, plans for your herd, which are completely appropriate, would be a discussion with your veterinarian, and I'm happy to join in on that.
Okay, don't your samples have to be submitted by your vet anyway?
Yes. Your samples have to come. So even if you were to drive a carcass to the lab, your veterinarian has to fill out a form. So we only get results to veterinarians. They're our clients. We consider them our clients because they're the ones who have to, make a decision with those results. I'm just here to kind of interpret and guide the veterinarians. And yes, so the samples at our lab have to come from veterinarians. All right. Thank you so much. Thank you so much, Elisha. And now we'll get back to Dr. Manny. Okay.
Thank you, Lisa.
Thank you so much. Okay. So,
Yeah.
so Dr. Manny, some of the questions you had were, if homuncus is present in a sheep but is not non-pathogenic, is there a threat that it could become pathogenic if not treated with dewormer? And she's wondering if sheep with non-pathogenic homuncus should be treated. So wouldn't some of that be a matter of just how much homuncus the animal actually had?
Yeah, so homuncus is always pathogenic. The distinction here is like, as you suggested, like the number. I'll give an example. So if an animal is harboring around 5,000 worms, and they can suck around 250 ml of blood on daily basis, and then that can be a fatal cause for that animal. So, but if it has just 250 instead of 5,000, still they are going to suck blood. It's not going to cause death, but it may cause anemia and all those things. So the pathogenicity is not, the worm is always going to be pathogenic, but the number of worms that are present at a given point of time decides about the intensity of that disease. So if you are seeing or confirming homuncus in an animal, like I would always say, okay, go ahead and treat. Like you should not wait until the number builds up to go and decide about treatment. I don't know if I'm making sense.
And at the same time, if you're doing FOMACHA scoring every 2 weeks or every week in your herd, and the animals are looking, have very good FOMACHA scores, and the egg counts seem fairly low, then those wouldn't be animals that you would go ahead and treat. Instead, you'd be treating the ones that had poorer FOMACHA scores.
And that's where exactly that refugia maintenance is required. You don't need to treat all animals in a herd, and homuncus is pathogenic even in low number. But if the animal is doing well, you just need to allow that animal to carry that refugia. And there are studies done to show that, like, when allowing that, that animal, which is maintained as a refugia, the production metrics on that particular animal gets lowered. But at the end, like if you look at the whole flock, whole herd, the production metrics is improved. So that's what I'm trying to say is, like, yes, they are pathogenic, but strategically, you should not treat all animals in a herd and leave a certain portion of that animal, and maybe based on FOMACHA chart, scoring, like you have to leave that animal without treatment. That helps with mitigating the emergence of fast emergence of resistance in a herd.
And we would tend to do a 5-point check because some of the other strongyle type worms won't be causing anemia, but instead they'll be causing diarrhea or just poor uptake of nutrients as they disrupt the digestive system. So because of that, we look at a poor hair coat on an animal, or a weight gain that's less than what the rest of the young animals in the herd are doing, or diarrhea and things like that.
That's correct. Like homuncus in general don't cause diarrhea. They mostly cause anemia and death, but other strongyles do cause diarrhea. So if you are seeing diarrhea associated with strongyl count, like, the disease is now like caused by a different strongyle than homuncus. But again, based on clinical science and FVC, and you mentioned about the 5-point check, like all this should play a role in deciding the targeted selective treatment.
And one question we have, as a measurement and takeaway, with a combined sample, at what level would you suggest to give treatment? And I know that one problem we have is that some of your strongyle worms, like homuncus, are heavy egg layers, whereas some others, like say Nematodyrus, are not really heavy egg layers. So that makes it hard to tell from the egg count how many adult worms are actually there. But do you think the chart you showed earlier works for looking at the combined samples, or what would you suggest?
I think discussing with Dr. A. Kaplan, who kind of devised this combined composite fecal egg count reduction test, he wants to stick with the recommendation given if you are doing like a fecal account in an individual animal. The same can be did with the numbers that you are getting with the composite fecal examination. I read some literature where they have a policy of treating anything above 750 when doing composite fecal examination. So each farm are like, researcher, they have their own way of interpreting, and that just comes with analyzing other factors in the farm and then coming up with that threshold or cutoff above which like treatment need to be.
And one question we have is, when evidence of tapeworm is seen within a lamb flock, how can we determine which animals are affected without taking a fecal sample from each animal, which is difficult with many lambs on pasture? So I guess one question that comes up there is just how pathogenic is tapeworm, and do young animals build up resistance to it? And then also, if you're showing or selling animals, even if tapeworm isn't very pathogenic, it doesn't look really good if your animals go in the show ring and shed a whole bunch of tapeworms there in front of the judge.
Yeah, so if you compare the pathogenicity of a tapeworm with a Haemonchus, so they are no match to Haemonchus. So animals harbor tapeworm, but they tolerate well, and there is no associated clinical signs in many of the cases. But if sometimes like you may see the segments that are shed in, and that how like you can confirm if tapeworm is present there or not. Other than that, like tapeworms are non-pathogenic and they tolerate well, but it again depends on the number. Like if the tapeworm, they grow lengthier, much larger than Haemonchus, but if they are completely blocking the gut, and that would in turn, or they are completely blocking the intestine, that would in turn affect the normal absorption of nutrient. And in that way, like indirectly, there may be some effect that can happen to the ruminant, but it's not considered that pathogenic.
And it can also make them a little bit more prone to enterotoxemia because of the starch in the tapeworms, or what can cause them to be more susceptible to enterotoxemia if they've got a heavy tapeworm load?
I'm sure about enterotoxemia associated with the trematodes, which are other worms, but the cestode ones I'm not that familiar with.
And someone is asking, do you have any statistics regarding copper oxide wire particle treatment? And so maybe before you say something, I will say something about, we've done about 16 studies in New York on copper oxide wire particles. And what we found is it seems to work against, number one, it only works against Haemonchus. So if you've got brown stomach worm damages the gastric glands of the true stomach, and it makes it so that the true stomach isn't acidic enough for the copper oxide wire particles to dissolve, and they need to dissolve in order to hurt the Haemonchus worms. And so we've known for a long time that when animals are heavily infected with brown stomach worm, copper oxide wire particles do not work as a copper supplement. And also because your other worms don't spend much time in the true stomach, the copper oxide wire particles aren't going to be effective against your other strongyle type worms. So you need to keep in mind that it's really only effective against Haemonchus. So that's where doing a 5-point check and seeing that a lot of your animals are anemic, or doing, sending in your fecal samples, and if there's more than 100 strongyle eggs per gram, asking for the peanut test to be done to see how much of those are actually barber pole worm can be helpful. But the other thing is, we found in our studies that on some farms, copper oxide wire particles seem to be very effective against Haemonchus, and this was true in 3 years of studies at the St. Lawrence County Cooperative Extension Livestock Farm, sheep farm. It was very effective there. Versus at other farms, it didn't seem to be very effective at all. And if you've got a really, really serious heavy dose of homuncus in your animals, the copper oxide wire particles cannot be relied on to save that animal. You know, you're going to want to use a dewormer. But what's often recommended is if you are doing FAMACHA testing checking on your animals every 2 weeks, at least every 2 weeks during the grazing season, you can give those copper oxide wire particles to your animals that are scoring a 3, as well as giving them a dewormer or possibly skipping the dewormer on them and seeing if it works in your herd. But we found that there were a lot of differences between different herds and flocks in New York as far as how effective the copper oxide wire particles were. But I'm going to throw it over to Dr. Lejeune now and let him tell us what he's observed as far as copper oxide wire particles, either in the lab or in the research.
You know, you are an expert on that. Like I'm not. I'm a diagnostic guy, but my knowledge about COWP is very minimal. Whatever I learned from the book that I'm reflecting in here. But one experience I have is like one of the organic farm in New York State with which I have collaborated in the past. And they used copper oxide wire particle. And then we still continue to see homuncus in there because I used their sample for specifically identifying homuncus. I think after 7 to 14 days, like we still saw homuncus coming after this treatment. So, but in other references that I have, they claim like it is highly effective, but I said like there may be, as you said, like there is other factors that would help with the efficacy of COWP treatment.
Yeah, I think one big thing is you need those copper oxide wire particles to dissolve, and we're not always sure why they dissolve, in some animals and don't dissolve well in others. So, like I say, Betsy Hodge was at the St. Lawrence County Extension Livestock Farm, and they worked really well, but our studies at other farms were not nearly as positive. And so I don't know, Betsy, if you have any thoughts or not on why it seems to be helpful in some cases and not in others.
I don't know. We weren't feeding any grain, and I don't know if that made a difference.
Right.
They were out on pasture only.
Yeah.
And I don't know what all the others were doing for sure, but I thought that might be related.
And I think too that the Extension Learning Farm had almost they had never done any copper supplementation on the animals there. And so
only regular minerals.
Yeah, they hadn't really had a chance to build up a resistance. The barber pole worms in those animals hadn't been exposed to much copper, so hadn't had much chance to build up a resistance. I think we also talked about maybe the flock was a little deficient in copper, and copper is really important for the immune system. And even though copper is very toxic to sheep and goats, so you want to give only very tiny amounts of it to sheep. It can be very toxic compared to goats.
They were receiving a sheep mineral the whole time, so I mean,
Right.
we can speculate that, but
yeah,
they should have been getting copper in the mineral, some at least.
Yeah, though probably very little actually, since it was a sheep mineral that they were getting.
Yeah.
And so they may just have been a little deficient in copper too. And so by getting the copper oxide wire particles, it may have helped to boost their immune system. Versus, it seemed like some of the farms we were giving the copper on, some of the goat farms were already putting a lot of copper in the grain and in the salt as well. And there have been some studies that show that animals can become resistant to the copper oxide wire particles. And so that's why we tend to say, don't give them to everyone in the herd instead use them as part of a 5-point check or a FAMACHA check, you know, and give them to the animals that are anemic and stuff.
Yeah, and next time we do that study, Todd, we should do a copper status on all the labs.
Yeah. Us retired folks. So folks, and any more questions for Dr. Lejeune? I know one question I had, Dr. Lejeune, is, are you seeing much trouble with ticks at all in sheep and goats, or are they pretty resistant to Lyme disease and other tick problems?
The tick problem is very constant here, and we see fluctuation in the different types of tick species that we see every year, like Ixodes scapularis or the deer tick, which we used to see few years ago, and then Dermacentor variabilis. Now we are seeing their numbers are more in the last 2 years. And you guys, I don't know if you are aware of another exotic tick species that was introduced in 2017 in New Jersey. I won't say introduced, but it was first identified in New Jersey. And after that, like there were a lot of reports of this exotic new tick species, also called, the common name is Asian longhorn tick, and the scientific name is Haemaphysalis longicornis. And it's now seen everywhere, at least in 13 states in eastern USA. So we see that
Abel, I'm in the
emerging.
middle of a Zoom meeting.
Yeah, so the new information is like new exotic tick, Asian longhorn tick is getting upper hand in many of the counties, especially in the eastern coast. Did I answer your question?
So we remove ticks from our sheep every now and then, our dairy sheep. Should we be concerned at all?
It depends upon what tick species it is. The new one, the Asian longhorn tick, it's not known for transmitting any disease, at least here in the US, but they are capable of proliferating even without a male. So the females are, we call that as parthenogenesis. So they are parthenogenetic, meaning females can reproduce without even the presence of a male. So their numbers can build up on an animal. And if their numbers are more, they suck blood. And we know death associated with the increase in the number of ticks present on a host. In West Virginia, you know, in a cattle farm, 2 cows died just because of the huge number of this tick present on the body of that host. So that's an issue. But if you are pulling a tick from an animal, we need to identify what it is. Unless like you identify, like we don't know whether it is Haemaphysalis longicornis or the normal Ixodes scapularis. So only after doing the appropriate ID, then you can infer what it would cause to the animal.
Are there any more questions for Dr. Lejeune? All right. So I guess we'll go ahead and close with that. I am going to put up this slide of the pasteurizer that's for sale, in case anyone knows of a buyer for it. Do people see that slide? And then we'll hopefully meet again next month, and our speaker will be Richard Earhart on factors affecting litter size in sheep and goats. But Dr. Lejeune, thank you so much. And it's exciting to hear about the possibility of doing combined samples for looking at your pre number of worm eggs per gram for and your 14-day later after deworming to see if a dewormer is actually still effective in your herd. It's neat that that's going to become a possibility to do that.
Yeah.
And
thank you, Dr. Stanton, for hosting me. But it's a pleasure to talk to you all. I'm still new, learning a lot, and trying to convey my knowledge, but I may be a little late. But I guess like you got the message, right? So thank you for having me.
And thank you for your help, especially with things like strongyloides, as far as how many eggs per gram can be a problem with that, and then I don't know. I guess one last question would be, when it comes to deerworm, is there really anything that can be done for people to try and see if that's their problem or not that they're having in the
you
fall?
mean the brainworm?
Right.
Yeah. There is no appropriate test that is available now to confirm antemortem diagnosis in animals that suffer from brainworm infection, especially in aberrant hosts, which are like sheep, goat, and horses. So there's no test available. There is one group at University of Tennessee. They are in the direction to develop an ELISA test, a serological test, to detect antibodies for this worm. But again, I don't know how far they succeeded, but there are some efforts, but to my knowledge, there is no good test available now to confirm P. tenuis infection in aberrant hosts, which are sheep and goat. So only during postmortem we can confirm that. Even with postmortem, it is even difficult to locate where exactly these worms are migrating, and you got to be lucky to find that lesion at postmortem to locate the worm and confirm by sending that sample to us, and we have to identify. It's really hard, but most of the time treatment is just done based on the symptoms, clinical symptoms. But when you experience clinical symptom in an animal, it's kind of an advanced stage. Like even if you are confirming there's no appropriate treatment to get a cure at that stage. So that's the reason why, like for example, in South American camelid farm, they continue to give preventive treatment, like exposing the animal for every 10 days. Every 10 days, they treat the animal with anthelmintic, with the idea that the larvae that are ingested by the host, it takes 10 days for them to go into the central nervous system or to the brain. So if you are thinking about treatment, you have to treat within that 10 days. If the worm escapes and gets into the central nervous system, then the drugs that we are using would not penetrate and kill the larvae when it gets into the brain. So you have that window, narrow window of 10 days. That's the reason why they expose their animal every 10 days with an understanding that that frequent treatment would kill any migrating larvae before they get into the brain. So it's very challenging. I don't think like we have a proper test or proper treatment available to deal with brainworm infection in sheep and goat.
I know that Mary Smith and I did do a study, where we looked at 2 treatments and actually had fairly good luck compared to not treating at all in recovery rates. That wasn't that, the goats were being observed more than the sheep. And so we were probably catching the goats earlier in infection than we were catching the sheep. But it did seem like treatment was, did help, help with them.
Yeah, there are different strategies now people are discussing about, like using some drug to relax the blood-brain barrier that would allow the anthelmintic to pass through and kill. So there are little, like some advancement made in that type of research, which proves that, relaxing the blood-brain barrier would allow the anthelmintics to get into the brain and kill it. But even if it goes into the brain and kills, like the dead worm itself would cause some sort of inflammation, which would again continue with the disease. So it's a challenge. Like you can treat, but again, the dead worms would cause inflammation, and again, it causes neurological condition. So it's a big challenge to even detect and treat or manage after treatment. So it's a difficult situation.
Yeah, I think for many of us, it's just a way of life having it, and we've had, you know, we've had animals that have totally recovered, and then, like you say, animals that, you know, didn't recover completely, and every time they're pregnant, it's harder and harder on them. You know, you know, you can see the damage that's been caused by the worm, and that damage, you know, whenever they're in late pregnancy, becomes more of a problem each year, you know.
Yeah,
right.
we recently saw a reindeer with a worm migrating in the eye. It's still alive, it's moving, but the animal was pregnant, so we didn't do any treatment, and we couldn't able to do anything to remove the worm because they were in the interior chamber, so it's really hard. We just left it. That's it.
Okay. Well, thank you so much.
No problem at all. Thank you very much.
And we would, I'll go ahead and stop the recording, and thank you all for participating. Okay.
Thank you everyone for listening.
Okay.
Bye for now.
All right. Okay. Bye-bye. Who's still on? Betsy, can you tell if it's still recording? I've somehow lost all of that.
It does look like it's recording.
Okay.
I might be able to stop it. Hold on. There. Well, yes.